Do you often wake up feeling as if you haven't slept at all? Or perhaps your partner complains about your loud, disruptive snoring. Maybe you find yourself gasping for air in the middle of the night. These are not just minor annoyances. They can be signals from your body that something is wrong with your sleep. Millions of people experience these issues. They can seriously impact long-term health, starting with heart function. They can affect blood pressure, and even your mental clarity. Understanding the root cause is the critical first step toward reclaiming your energy and well-being. This is where sleep tests become so important. They are the tools doctors use to look under the hood and diagnose what is truly happening while you are asleep, so you can get the right help. To solve these sleep mysteries, doctors primarily rely on two major types of tests. The first is the traditional in-lab overnight sleep study, known medically as polysomnograms. This is a comprehensive evaluation conducted in a specialized clinic. The second, and increasingly popular option, is the home sleep apnea test. This allows you to gather important data from the comfort and familiarity of your own bed. Each approach has its own set of advantages as well as disadvantages. The best choice depends entirely on your unique symptoms, your medical history, and your personal circumstances. Next, we will carefully compare these two powerful diagnostic methods. The decision between an in-lab study and a home test is a significant one. It can influence the cost of your diagnosis and the convenience, as well as the specific clinical details a doctor can discover about your disturbed sleep patterns. For some individuals with straightforward symptoms that point toward a common condition like obstructive sleep apnea, a home test provides a quick answer. It's an efficient option, as well as more affordable. For others with more complex or overlapping health issues, the detailed, supervised environment of a sleep lab is absolutely essential for a correct diagnosis. Next, we'll delve into the differences between the two to give you a clear picture of what each experience entails. We'll discuss who each option is designed to help most, so you can have a more informed conversation with your healthcare provider. Our conversation will also introduce a specific modern home testing device, the ResMed Night Owl. This tiny, user-friendly device represents the latest evolution in home sleep diagnostics. We'll explain in simple terms how it works, what it measures, how it can be used to identify a problem like sleep apnea, and also how it can be used to monitor the effectiveness of your treatment over time. By the end, you will have a complete guide to understanding your options. You will learn how to weigh success versus comfort, and cost versus value. This information will empower you to take an active role in your own health and start the journey toward the restorative sleep you deserve. The in-lab overnight sleep study, or polysomnogram, is often called the gold standard for a reason. It is the most thorough and detailed sleep test available. When you arrive at the sleep clinic, which can feel like a hybrid between a hotel room and a medical facility, a technician trained in sleep will greet you. Their goal is to make you as comfortable as possible while preparing you for the study. The process involves carefully attaching a series of sensors to your body and scalp to monitor brain waves and stage your sleep patterns. Some will be placed near your eyes to track rapid eye movements and record REM sleep, and some will be placed on your chin to measure muscle tension, and also on your chest and legs to record heart rhythm and limb movements. It sounds like a lot, but the technicians are experts at placing them securely yet comfortably. Once you are wired up, you will be invited to go to sleep in a private, quiet room. While you rest, the array of sensors transmits a continuous stream of data to a control room nearby, where a technician monitors everything in real time throughout the night. By watching your brain waves to see when you enter different stages of sleep, and by monitoring light sleep, deep sleep, and REM sleep, they observe your breathing patterns, listen for snoring, and count each and every time you stop breathing while measuring the oxygen levels in your blood. They track your heart rate response to the oxygen drops, and any leg movements that might indicate a separate sleep disorder. This constant supervision is a key advantage of an in-lab attended study, with the primary benefit being its comprehensive approach, its accuracy, and depth. Because it measures so many different biological signals at once, polysomnograms can diagnose a wide range of sleep disorders beyond just sleep apnea. Disorders like narcolepsy, REM sleep behavior disorders, periodic limb movements, as well as certain types of seizures that occur during sleep. Also, if a sensor happens to fall off during the night, the attending technician can come in and reattach it, ensuring that a full night of high-quality data is obtained. This level of detail and oversight provides your doctor with a complete and undeniable picture of your sleep architecture and any disruptions within it. However, polysomnograms do come with their own set of drawbacks. The most significant one being the cost, as in-lab studies are considerably more expensive than home sleep tests. Also, for many people, the unfamiliar environment of the lab can be a major hurdle. Sleeping in a strange bed while being connected to numerous wires and watched on a camera can induce anxiety or what's called the first night effect for some patients, which causes them to sleep differently than they would at home. This can sometimes lead to results that don't perfectly represent your average night of sleep. Furthermore, you must travel to the clinic, which may be inconvenient, and wait for an appointment, as many labs have long waiting lists. In response to the cost and potential inconvenience of in-lab studies, the home sleep test has emerged as a popular and effective alternative for many people. The core idea is simple. Instead of you going to the lab, in a much simplified form, comes to you. A home sleep test involves a small portable device that you wear while sleeping in your own environment in bed. These devices are designed to be user-friendly, and you typically receive them from your doctor's office or have them mailed directly to your home with clear instructions. The focus of a home sleep study is narrower than an in-lab study. It is primarily designed to screen for sleep apnea or for those without complex medical conditions. Clearly, the experience of using a home sleep test is far less intimidating than spending a full night at the sleep lab. Most devices consist of just a few components. You will likely have a small sensor that clips onto your finger to measure your blood oxygen level and heart rate, a pulse oximeter. There will also be a small cannula that sits just under your nose to monitor your airflow and breathing effort, and sometimes a belt that goes around your chest to track breathing movements. You put the device on yourself right before you go to bed and sleep as you normally would. The lack of wires on your head and the familiar comfort of your own bedroom often leads to a more typical night of sleep. The advantages of a home sleep test are clear and compelling. First and foremost, the cost is significantly lower than an in-lab study, making it a much more accessible option for most patients. The convenience factor is also a huge plus. You do not have to travel or disrupt your daily routine by spending a night away from home. And because you are sleeping in your own bed, the data collected is more likely to reflect your actual night-to-night sleep patterns, finding yourself free from the anxiety that a clinical setting can cause. For individuals with a high probability of moderate to severe sleep apnea and no other major health complications, a home sleep study is the fastest, most efficient, and least expensive route, with multiple nights of data easily obtained. Despite the benefits, home tests do come with some limitations. The biggest is that they collect far less data per night. Most home studies do not use EEG sensors, so they cannot measure brain waves, which means they cannot accurately determine sleep stages, like deep or REM sleep, or diagnose sleep disorders that are not related to breathing. Disorders such as insomnia, narcolepsy, or periodic leg movement disorder. Another potential challenge can be the lack of supervision. If a sensor falls off or is not positioned correctly, there is no technician to fix it, which could result in an inconclusive test that needs to be repeated. As a result, home sleep tests are not suitable for everyone, as previously mentioned, especially those with complex medical histories or symptoms that suggest a disorder other than sleep apnea. Among the growing field of home sleep tests, the ResMed Night Owl stands out for its remarkable simplicity and miniaturization. This device pushes the boundaries of convenience, offering a powerful diagnostic tool that is incredibly small and easy to use. The entire system consists of a sensor about the size of a quarter that you tape to the tip of one finger. That's it. There are no chest belts, no nasal cannulas, and no complicated arrays of wires to manage. This minimalist design is intended to reduce any discomfort or awareness of the device, allowing patients to sleep as naturally as possible without anything getting in the way or disrupting their sleep. The process of using the night owl is a snap, making it virtually foolproof. Before you go to sleep, you simply open the Night Owl app on your smartphone. The app guides you through a few simple steps to pair the sensor with your phone via Bluetooth. Then, you use a small piece of medical tape, which is included in the kit, to secure the sensor to your index finger. Once it is in place, you just go to sleep. It's that simple. The sensor automatically detects when you are sleeping and begins recording data. It can be used for multiple nights to ensure enough information is gathered to provide an accurate assessment. In the morning, the data collected overnight is automatically uploaded from the sensor through your phone to a secure cloud server for a sleep physician to analyze. Despite its tiny size, the Night Owl sensor is packed with sophisticated technology. It uses a technology called photoplethysmography, or PPG, which involves shining a light through your fingertip to measure changes in blood volume. From this single point of contact, it can accurately derive several critical data points. The device measures your blood oxygen levels, your heart rate, and, through advanced algorithms analyzing these signals, it can then determine your body movements and estimate your sleep stages. Most importantly, it calculates the apnea-hypopnea index, which is the number of breathing pauses or shallow breaths you experience per hour of sleep. This calculated score is the key metric used to diagnose the presence and severity of sleep apnea. The Night Owl device is primarily designed to diagnose obstructive sleep apnea. It excels at identifying the telltale signs of this condition, such as recurring drops in blood oxygen levels and the elevated heart rate that accompany the breathing interruptions. The detailed report generated for your doctor will show a clear graph of your oxygen levels and heart rate, while identifying every breathing event throughout the night. This information is typically sufficient for a physician to confirm a diagnosis of mild, moderate, or severe sleep apnea and recommend a course of treatment. However, it is important to remember its purpose. Because the device does not directly measure brain waves or airflow, it is not intended to diagnose more complex sleep disorders, and therefore, it is best used for patients whose symptoms strongly point toward sleep apnea. However, the utility of the ResMed Night Owl extends far beyond just the initial diagnosis. One of its most powerful uses is monitoring treatment effectiveness over time, as obtaining a diagnosis is just the first step in the process. The true goal is finding a treatment that restores healthy sleep. So after you begin a therapy, whether it's a CPAP, an oral appliance, or simply lifestyle changes, it's crucial to verify that your problem is being resolved. The Night Owl offers a simple, non-invasive home check that gives both you and your doctor objective feedback. For example, Anna was diagnosed with moderate sleep apnea via a Night Owl, and her doctor prescribed a CPAP. After a month of nightly use, Anna feels more rested, but her doctor wanted supporting data. So rather than returning to the sleep lab, she underwent a multiple-night Night Owl home sleep study in the comfort of her home while on CPAP. The device records oxygen levels and breathing events, providing a clear side-by-side comparison with the initial diagnostic test. This follow-up is called an efficacy study, and the results can be quite revealing. Anna's disruptive breathing events dropped from 25 events per hour to 3 events per hour. Her oxygen saturation graph, once full of sharp drops, is now stable and healthy all night. That confirms CPAP is working. If her breathing events had remained high, it would have indicated that changes were needed. Perhaps adjusting her CPAP pressure settings or trying a different mask for a better seal. This easy check-in is invaluable for determining CPAP settings, for assessing the efficacy of a custom fabricated oral appliance, or even for measuring the impact of weight loss. Example: John chose an oral appliance as his form of therapy. But after 3 months, the Night Owl showed reduced but persistent breathing events with continued drops in oxygen levels. So the appliance was further adjusted, until a follow-up test confirmed normal breathing. Choosing between an in-lab sleep study and a home test like the Night Owl can feel daunting, but it becomes much clearer when you consider your individual needs. The final decision should always be made in consultation with your doctor, but understanding the guiding principles can help you have a more productive conversation. The right test for you hinges on the complexity of your symptoms, your overall health, your budget, and your personal comfort. By weighing these factors, you can confidently select the diagnostic path that will lead you to the answers you need and the restful sleep you have been missing. We will consider your symptoms, such as loud, consistent snoring, witnessed pauses in breathing, significant daytime sleepiness, or have you been previously diagnosed with sleep apnea and are just in the need of an update? For those in otherwise good health, a home sleep apnea test is often the perfect starting point, and the ResMed Night Owl, with its ease of use and accuracy for this specific situation, is an excellent example of a modern home sleep testing device that offers a fast, convenient, and cost-effective way to obtain a diagnosis, making this route ideal for those individuals wanting to minimize disruption to their lives while obtaining a straightforward answer about whether or not they have sleep apnea, allowing them to initiate therapy without delay. On the other hand, the in-lab polysomnogram remains the essential choice for more complex situations. You should lean toward an in-lab study if your symptoms are ambiguous, or if you suspect a sleep disorder other than just apnea. For instance, if you experience sleepwalking, acting out your dreams, unexplained leg movements at night, or excessive daytime sleepiness without prominent snoring or pauses in nighttime breathing, then a home test might be insufficient. Furthermore, patients with significant coexisting medical conditions, such as congestive heart failure, chronic lung disease, or certain neurological disorders, require the comprehensive monitoring and expert supervision that only a sleep lab can provide. Ultimately, there is no single best test, only the best test for you. Think of it as a tiered approach. For many, a home test like the Night Owl is a logical and efficient first step. If the results are positive for sleep apnea, you can proceed directly to treatment. If the results are negative, but your symptoms persist, or if the data is inconclusive, it may be recommended that you undergo a full in-lab study to dig deeper. The most important action patients can take is to stop ignoring the symptoms, because poor sleep is not something you have to live with. Talk to your physician or those of us at Restful Sleep to discuss your options in taking your first step or your next step towards sounder sleep and a better, healthier you. Finding the right test is the beginning of your journey back to health, energy, and a truly restorative night of sleep. And personalized medicine is the way to get where you want to be.
And here is why you need personalized medicine that understands you, not your neighbor, not a study average, and not your insurance company's requirements, but you. Right now, doctors often prescribe based on averages as required by insurance companies. Personalized medicine flips that script. Want more breakthroughs and better healthcare? Stay curious, ask questions, and self-advocate for personalized care.